Hey everybody, we are back here at Roswell Park Comprehensive Cancer Center with Dr. Ermelinda Bonaccio, who is the Chief of Breast Imaging. And today we're going to talk about something that a lot of women are familiar with, and that is dense breasts. So good morning, nice to have you back.
Good morning, thank you for having me.
How do you define dense breasts?
So it's a mammographic finding, an X-ray finding. You can't tell by how you feel. It's basically the amount of glandular tissue you have in your breast. So what that means on a mammogram is fatty tissue is gray or black and glandular tissue is white. And it relates to the amount of white tissue you have. So if you have more than 50% of that glandular or white tissue on an X-ray, your mammogram, you have dense breast tissue.
The good news is that if you're coming here for your mammography, you can do a mammography in 3D, and that's very beneficial to see what's there if you have dense breasts.
Correct. A tomography or 3D mammography has been shown to improve our ability to find breast cancers in all women, but especially in women who have dense breast tissue. However, it still is less sensitive than in women with dense breast tissue than a woman who doesn't have dense breast tissue.
Is there any particular kind of woman who presents with dense breast tissue more than any other?
Usually younger women and women who are premenopausal are more likely to have dense breast tissue, and as we get older, many women will become less dense, but some older women will stay dense, but the percentage will decrease.
Does having dense breasts give you a higher propensity to get breast cancer?
Right, so we are concerned about breast density for two reasons. That white tissue can hide a breast cancer, so the mammogram can be less sensitive. And then the other reason is that in and of itself, having dense breast tissue is a risk factor for breast cancer. It doesn't make a woman at high risk for breast cancer, but it does increase their risk of developing breast cancer.
So let's say someone is coming here for the first time to have their mammogram, and that's a great idea, by the way, because you don't have to be a prior patient. You should let you folks know if you have been told that you have dense breasts, so that you can make sure you're getting the 3D.
Well, everyone here actually gets the 3D mammography. So all of our patients who have a screening mammogram will have the 3D mammography. But we will, and we're required by the state to notify the patient that they have dense breast tissue. And then begins the conversation. We give them some information, a pamphlet about having dense breast tissue, and then really that requires a conversation with your physician or with the breast imager or whether we should do something more. Because the most important thing if you have dense breast tissue is actually to continue to have a mammogram.
Absolutely.
The question is whether you should have any additional testing. If it turns out you have other risk factors, not just having dense breast tissue, then potentially having a breast MRI every year in addition to the mammogram might be indicated. For some women who are at average risk and the only risk factor they have is dense breast tissue, we may consider ultrasound. But the data is not as straightforward as mammography, so there is a risk-benefit that you need to discuss with your physician. With ultrasound, for example, we do find a lot of false positives, meaning abnormalities that turn out to be fine, but may require follow-up or a biopsy. But we do find additional conversation. So some women will choose to have additional testing if they have dense breast tissue in addition to their mammogram, and someone will decide not to. But it's a conversation you should have with either your primary care doctor, GYN, or potentially the breast imager you're meeting with.
Do you have any idea what the percentages of women who present with dense breasts?
So overall, if you take all women, about 50% of women will have dense breast tissue. As we get older, that percentage decreases, so that means a greater proportion of younger women will have dense breast tissue.
Well, we've learned a lot, and you know, this is another reason why you're going to want to have your mammogram here at Roswell Park. We want to thank Dr. Ermelinda Bonaccio. She is the Chief of Breast Imaging, and believe me, when you come here, their care is paramount to making sure you get the very, very best test and the best test results.